So good morning, everybody. I'm going to start my talk a little bit differently because I want to see some show of hands. So this is audience participation time. How many of you have had genetic testing for HCM? How many of you have found a pathogenic mutation that causes your HCM? Hands up on that one. Okay, so a little less than 40%. Okay. How many of you have any kind of device in your body for your heart? Okay, good one. How many of you are on myosin inhibitors right now, Camzyos or Afi? Not me, but over there. Okay, good. Just gives me a little understanding of where we're all coming from. And I'm going to not do my personal story today. If you want to hear that, it's online a million times. But I do come from a family history of HCM. I was diagnosed at age 12 myself and had a heart transplant back in 2017. I have to time that now. Believe it or not, I kind of forget that part of my story from time to time. So if you have any personal questions, you can ask me, of course, but I'm going to spend time talking about the services of the HCMA because some of you are new to me, and I've not met you. Some of you I've known a long time. I've known Betty Leibowitz for, I think it's 27 years, I figured out last night. So some of our relationships go back a long way, and some of us are just meeting. So this meeting that you're attending is part of our Big Hearted Warrior Tour. It was supposed to be an in-person tour like this all around the country, starting in March of 2020. And the first one was supposed to be with that guy in the back corner there in a little place called San Francisco where there was a boat full of really sick people, and we decided not to go. So they turned into virtual tours. You can go see them all on our YouTube channel. If you wonder what another center thinks about HCM or how our knowledge has evolved, you can go take a data dive at any time on YouTube or on our website. My slide on Centers of Excellence is currently out of date as of last Wednesday. The HCMA has built now 57 HCMA recognized Centers of Excellence. We welcome Tampa to the team, but that's not been publicly announced yet. Shh, don't tell. I do a podcast typically on Fridays, and I just got a new topic for one today. We're going to talk about EV-ICDs coming up soon. So if you want to learn about HCM in a different way and you don't want to sit and watch slides and you want to just listen to people talk, we are there with thought leaders on various topics, typically every Friday, or patient stories as well. We have a program, if you pick up the blue card at our table, called HCM Academy, which allows you to help educate your community physicians on HCM. It is a free CME course, so doctors have to do CMEs, so we provided a course on all different aspects of HCM. If you have not taken part in our intake and navigation process, any person worldwide with hypertrophic cardiomyopathy is welcome to contact our office. We have a team of intake coordinators who will collect information from you and then help you with a navigation call. We've just added another physician assistant to our navigation team, and we're excited to have Annie with us. We process over 1,000 phone calls a year at the HCMA, plus emails, plus social media, plus. So we're talking to a lot of people every year. We have currently 12, but we're adding at least 3 more this fall, online discussion groups. Gwen Mays is one of our discussion group leaders. She's in the back right there. She handles Talking It Out with Gwen, and it's a mental health program. So if you want to just get some connectivity to other people in our community, that is a great place to do it. So I'm going to kind of walk you through the intake process. How many in the room have done intake with us? I know a couple of you have. Okay, so we got some more phone calls to do. So you call, you set up an appointment, you make it comfortable for you. Our intake coordinators will ask you questions a little bit differently than doctors do because we're patients and we're looking at it a little different. Then you will get a nest learning. So we'll send you either by app or by email, however you want to get your information, a couple of very quick screens to explain concepts to you. Let's say you haven't done genetic testing yet. It'll be about 5 or 6 screens on why genetic testing, what genetic testing, how genetic testing, and where genetic testing. Maybe you haven't had a stress echocardiogram, but if you're a patient of this program, I'm going to guess that you have. But a lot of people haven't. So we walk them through that process and help them educate themselves. Then they have an opportunity to meet with a nurse navigator to kind of go over their questions and make sure you understand your individual anatomy. Then there's some more learnings, and they always lead to what we've learned about today, high volume center of excellence care, because that's where you're going to get your best care. So any of you are welcome to participate in this process. You can use that Calendly link to set an appointment, or you can just call the office. So this concept of centers of excellence, I'm going to be honest, 26-ish years ago, we founded our organization in 1996. So a couple years into doing the work, it became obvious that not everybody was going to be able to get on an airplane and go to Minneapolis and see Barry Marin, or go into New York City and see Mark Sherrod, or go up to Boston and meet with Cricket Seidman and talk about their genetics. So I started to go to events all around the country, from American Heart Association, American College of Cardiology, and I might have met somebody in the room at one of those meetings and had a conversation and said, hey, you know where a really great place would be to build a center? Maybe Baltimore, and maybe you should start there, and maybe we can help you. And that became the Abraham program here at Hopkins many years ago. So we find doctors who have an interest in HCM, and we encourage them to make it not only their practice, but their career and their focus. And that has worked 56 plus times now, or 57 plus times now around the country, and this is our map. So you can see there's some places you don't really want to be with HCM, like Montana, Idaho. Well, Idaho, we have somebody kind of working on that right now. But there's better places than others to be an HCM patient. So that gives you an idea. Now I'm going to kind of pivot a little bit. A couple of years ago, we started to get focused on getting everybody around a day. So the last Wednesday in February is actually HCM Awareness Day. We didn't pick the beginning of Heart Month because the big organizations kind of steal the thunder and nobody would hear us. So we're there when the media doesn't have any more stories at the end of the month, and that's when our stories filter in. So as you can see in 23, we had a few states recognize HCM Awareness Day by proclamation, resolution, or law. Then in 24, it grew, and then in 25, we put the pedal to the metal. 26, we want more states, and there's one missing off of this form, and it's Maryland. So if anybody wants to help us get HCM Awareness Day passed in Maryland, just see Stacy, the redhead in the back. Stacy, raise your hand, and Stacy will help you get on a list that we can help you do the work to get the resolution done. So we also have a legislative initiative, and I've put the pop-up over here, for what we're calling the Children's Cardiac Safety Act. And I have some updates that are not on a slide on this one. So what is this? You've heard about student athletes being at risk for sudden death. Well, guess what? Only 20% of those who die from hypertrophic cardiomyopathy are actually athletes under the age of 24. The majority of people are not athletes. They're just normal people. We're just humans who have hearts, and 1 in 200 of them will have hypertrophic cardiomyopathy. So we have started in New Jersey, Virginia, and Nevada. I always forget Nevada. Sorry, Nevada. To implement a check in the well child examination. So for all children, when they go in for their well child exam, they will be asked a series of questions about family, heart health, history, and individual symptoms. This allows us to identify the individuals who need to be referred up to additional screening, and it's not always the same screening. It's not always an EKG, it's not always an echo, sometimes it's a CT scan, sometimes it's something different. So we want to make sure the right patients get the right screening at the right time, and this enables us to allow that individual family to talk to their individual healthcare provider to provide that information. And there's more information on the Children's Cardiac Safety Act nearby. The update here is, and this is like groundbreaking, we have partnered with the American Heart Association, and they will be taking a lift on 7 states coming in 2026 to help us pass this law. If you don't know how politics work in cardiology, getting the American Heart Association to jump in on your project is nearly unheard of. So the fact that they saw what we were doing and they're like, we like this and we're going to jump in. So we have some really good partners to move this forward with. And if anybody's interested in getting involved, please let us know. So that was our little congratulations to Virginia. I forgot about little Mr. Big Heart there. Okay, so we also have a report card because we know people like to kind of compete against each other, especially in politics these days. So we have a map that's set up, and as each state improves their cardiac screening and some issues related to preparedness and access, we give them a better score on the report card. You can stop by and visit that on our website at any time and see how your state is doing. This is what Maryland breaks down to. Unfortunately, no HCM Awareness Day. We have some AED laws in place in Maryland, but we could do better in private schools, health club, and public buildings. There's other issues related to the pre-participation screening form. We want one form per state so that you don't have home rule and each individual school system changes their mind on what to do. And we want the cardiac questions to be clear, concise, and we want coaches, family members to also get information on what the conditions are that cause sudden cardiac arrest in the young and heart failure for that matter. And we want to make sure that we have a systematic process to ensure that every child has an opportunity to have their heart checked. So we have now been to Capitol Hill twice. We went in April of this past year, and we went the previous February. I'm unclear right now as to what we're doing with our Hill Day for next year, but stay tuned. You'll see some notices on that shortly. We have gone to the Hill to talk about a couple of things. This year we spoke about something that we haven't talked about today, and that is generic drug quality. It's something that most people do not think of, but I encourage you to go look at our YouTube and see all the data on that, because I do not have ample time today. But here's the cliff notes. 15% of generic drugs in the United States are absolute garbage, and you're not taking anything, and you don't know it, and you can't tell by looking at a bottle. So we need better surveillance, and we need better communication and transparency on what is in the bottles that we're taking. The good news is there's about 25% of generics that are incredibly high quality and incredibly low price. So how do you know who the good one is versus the bad one? Go look at the YouTube, and if you have any questions, call us. It explains the entire process and how we're going to be able to achieve this. So I wish I had time to talk about that today, but I don't. What I really want to talk about is the All Hearts Collaborative. This is an initiative that HCMA took on about a year and a half ago, and it is piloting in Newark, New Jersey. The next states or cities up are Atlanta, Baltimore, San Diego, and Seattle. So what is it? It is an opportunity to get out into the community and talk to people about their heart health history and encourage them to speak to healthcare providers so that we can unmask these hidden hypertrophic cardiomyopathies, amyloidosis, and uncontrolled hypertension patients that are living in communities of color but are not getting out to healthcare. So we are working with federally funded health centers, working with the NAACP, we're working with community centers in Newark, building a model that we hope to bring to Baltimore. So if anybody is interested in participating in community events, tabling, like going out to health fairs and providing information on our app, please see Stacy and sign up on the form on the table out front. We would love to have you on our team. We also have something called the Lori Fund. If somebody needs to get to an HCMA recognized center of excellence for care, but they do not have the financial means to get there, if they qualify, we will provide them with travel stipends. So let's say you're a patient here in the Baltimore area, but for whatever reason, you need to go out to Cleveland or Mayo and you don't have the funding to do that. You can contact us and see if you can apply for a Lori Fund, or if you are interested, you can donate to the Lori Fund and make sure that your big-hearted brethren get to where they need to be for help. It could be Uber money from one side of town to another. It could be a hotel room for a night. Anything that's going to make it easier for a patient to get to the care that they need. We're very committed to make sure that happens. So I talked a little bit about our online discussion groups. They're getting a little bit of a refresh later this fall, and there's going to be a men's group, a women's group, and a nutrition group that are going to be added to the repertoire. So there's devices, surgery, medical management, mental health, the newly diagnosed, new to the HCMA. There's multiple sessions per week, so you're never more than a few hours away of talking to another big-hearted person and making sure that you have your support system set up at the convenience of your own home. Not everybody wants to get up at 8 o'clock in the morning or 6 o'clock in the morning to come out to a meeting in person. So sometimes from your couch, it's a little bit easier. So we have a lot of opportunities for volunteerism coming up. We're creating 15-minute micro-volunteer action moments where you can sit at the comfort of your home, send some letters to some state officials, maybe send a letter to your local hospital or to a school system. There's going to be lots of different activities that you can do, including health fairs and in-person events. If you're at all interested in volunteering and helping others get to the care that you've already gotten to, this is your way to pay it back and pay it forward. We also have an ambassadors program. One of our ambassadors is in the back, and we have a corporate ambassador with us as well. So if you want to share your story and you want to get out there more, whether it be through social media or in-person events and coming up and giving talks, talk to us. We have lots of opportunities coming up, and everybody is welcome. Don't say, I'm too old, I'm too young, I'm too shy, I'm too bold. Everybody is welcome to share your story, because you know what? We all have big hearts. We're all living our own experience, but there's somebody out there that can connect with you at that moment, and you might make the difference that you never really thought you could make. Knowing that you're not alone has got a lot of power. So I've just scheduled a new podcast on EV-ICDs, as I said on the side here. So the podcast is not only an opportunity for me to talk to clinicians, industry leaders, authors, but to patients as well, and to share those stories and make them real and make them accessible to people to understand that they are not alone. We have the opportunity to heal ourselves a little bit through shared experiences, and that comes into another project that we're working on that I didn't have an opportunity to put into this slide deck, I don't think. No, I didn't. Coming soon. No video on this one yet. We are building something called the Hearts and Minds Mental Health Network. Families like ours have gone through a lot typically, and we're always kind of waiting for the next shoe to drop, and that leads a lot of PTSD and stress and anxiety that we all have to live with every day. So we know that most therapists don't know us. They don't understand our disease state. They don't understand having a genetic risk. Our children could have the disease. They don't understand what it's like to have a device that could go off at any moment, and that frequent concern that something's about to break. So I'm working with Dr. Sam Sears, who is a psychologist who has spent his entire career building education and science around device patients and cardiac patients. So we're going to build a training module for therapists so that they understand us better as step one. Then we're going to be working with psychiatrists to make sure psychiatrists know how to properly medicate all of our mental health needs safely. And then we'll be working on addiction issues in the third phase of that project. So we know that it's hard, and we want to make it as easy as possible to navigate, and we want to make sure professionals know how to treat us. Speaking of professionals, the blue card on the desk outside is HCM Academy. I encourage you all to take it, share it, give it to your local cardiologist, your GP, whoever is in your life that is a medical provider. It's free CMEs. There's some great stories. There's great leadership on this committee to make sure that this education is the highest level possible. We are too building a registry. I built one by mistake because I started writing all your names and numbers on little purple cards back in 1996. And that has turned into a REDCap database as well. And that REDCap database is minutes away from IRB approval. We keep getting another question and another question, but it should be done very soon. I thought it was going to be done before this weekend. It's not. But you will all be getting contacted if you've talked to us before or during your intake. May we use your information in this registry, and you'll be able to consent where your data is used, either internally, HCMA only, with our research partners, or with industry. So you'll be able to decide where that goes. Additionally, and I'm going to try to wrap up here in a second, about 3 years ago, we met in New Jersey, and we held a meeting with professionals, and we were trying to figure out how we can make clinical trials more effective. And there were some problems with some clinical trial endpoint issues. So a trial is only as good as meeting its endpoints. And you discussed earlier the Odyssey trial. Was anybody here in the Odyssey trial? Nobody here. Okay. So it was a non-obstructed HCM trial. We know that myosin inhibitors work in non-obstructeds because the original cohort of patients that were tried on a drug was a group of 164 obstructeds and 60 non-obstructeds. Those 60 non-obstructed patients turned into 33 that stayed on therapy until May of 2025. And we saw miraculous changes in their phenotype, their EKGs normalized, their cardiac mass decreased, and they were feeling great. Unfortunately, that trial was canceled. But we know that it works because the endpoints were incorrect in the one trial and didn't really tell the story of the non-obstructed patient. We know that this can be a complicated thing because, and you guys are all going to go, this makes sense to me. So when somebody asks you what you're feeling like, are they asking you on a good day, an average day, or a bad day? How many of you have experienced HCM bad days? You've had a day where you just can't get off the couch and you have no idea why. And you've had great days where you can walk forever and do whatever you want. And you're like, I don't have a heart problem. This doesn't make sense. And then we have something in between. So at HCMA about 2 years ago, we started asking questions that way. What is your good day? What is your bad day? What is your average day? And we found that HCM patients don't stay in one New York Heart Association class. It can change by hour. It can change by day. It can change by season. So that's not a good endpoint, because if you show up on a bad day and tell a trialist it's a bad day, that might make the trial look bad. So we want to make sure we have better endpoints. And here's where you can help. Oops, sorry, my spacing worked out a little bit weird here. So there is a tool that is used in clinical trials called the KCCQ. And this is a set of questions that we ask heart failure patients. Well, HCM is not always in heart failure. We're just HCM patients. We don't see ourselves always as heart failure patients. Does that resonate with you all? Like, we're not always sick? So we're creating KCCQ HCM. And that survey link right there, I hope you all get out your phones and take a picture of that, because you can take a very quick survey and help us collect data on what your lived experience is, what your symptoms are, so we can write the questions properly so that we can truly measure success of a clinical trial. So I'm going to leave that up there for a second while y'all grab your phones and take a picture. And we'll make sure that everybody gets this emailed after the event. If you've given your email to the team here, we can get that out to you, or you can find it on our website. It is critically important that we, the patients, speak up and tell the clinical world what it is that we need from them. And this is your opportunity to have your voice heard. Okay, I'm gonna jump on to another. You can keep your phones out because I got a couple of other QR codes you might be interested in. Okay, done. So these are ways to donate and get involved. So general donations, All Hearts Collaborative directed, or Lori Fund directed. So you can take a picture of that and you can pick what you want to do later, hopefully. I want to also invite you all to come join us in New Jersey. If you've enjoyed this morning, you will enjoy a full day of being with your big-hearted friends. There's a lot more content, a lot more. We're going to be talking about hearts and minds. We're going to be talking about other initiatives that we're working on that we're not ready to discuss yet. So it is in Morristown, New Jersey on October 18th. We have a meeting during the day, a party at night, and for those who have the willingness to, a 5K on Sunday. So I'm hoping that you can all come out and join us. And in fact, there's going to be some opportunities for scholarship applications, so you don't have to pay any of the overhead. If you're interested in attending, see Stacy and she will help you with registration, and we'll get that done. Here are the ways to get in touch with us. We have a very active Facebook group. We just hit the mark of 13,000 in our private group, so that's amazing. You can follow us on LinkedIn, Instagram, whatever the blue one is now, Blue Sky, I think it is. And all of our content is available on Spotify, Podbean for our podcast, and then all of our videos are on YouTube. I'm going to go through some very, 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 very quick slides with you because I want to tell you a cool project we're working on. So William Roberts was a physician in Texas. He used to work at the National Institute of Health, and he is really a cardiologist, but more of a pathologist. And we have been collecting post-transplant hearts. So you're going to see some anatomy here of the hearts that are in our collection. I'm going to kind of go quickly through them. And there's somebody in the audience who's in my picture here. Where'd she go? There she is in the back. So that picture in the corner of somebody looking amazed at that collection of hearts, she's in the back, and I love that photo. So we take these hearts out to conferences to show the real anatomy of HCM. This is a young man from Bear, Delaware. He didn't have hypertrophic cardiomyopathy. He had LAMP2 Danon disease. These are the world's largest hearts, and in fact, this young man had the world's largest heart, and it is now in our collection. His heart weighed over 1,416 grams. A normal heart should weigh around 400 grams. That's a ballpark. But he donated this heart, and it is an amazing example of cardiac anatomy, and it stops people in their tracks every time. This is Lorianne Peachy. I've known her for about 25 years as well. She was transplanted in 2021, and she has met her heart again down in Orlando and had a little reconciliation with that heart. But it teaches us what a burnt-out HCM looks like. Her EF had dropped. And this is Janice. She had an apical myectomy and then went to transplant. Her sectioning is a little bit different. Unfortunately, she passed away 3 years after her transplant. But she was a fierce warrior and a teacher and a nurse. Irene Lindenberger, this is the heart that I mentioned. The entire LV cavity was papillary muscles. So even after myectomy, she just didn't have any volume. She was a long-term member. That was mine. Her nickname is the bitch because she tried to kill me, but I love her. My donor heart is Brandy, and she is an absolute angel and treats me very well. This is Hannah Sanders, which is actually Hannah Wolf, our new one of our new nurse navigators. Who better to have as a nurse navigator than somebody who managed HCM and transplant? And her heart actually burned out because she had a double mutation. She had troponin I and myosin binding protein C3. This is Amy Mann. It is her birthday today, so happy birthday, Amy. And it was also her go home from the hospital day in 2018. And she had a very narrow, thin ventricle. This is Victoria. This is what I call my chunky monkey heart. It is just all muscle. She had a tiny myectomy that you can only see this little divot taken out of the top of the septum. Did not solve her problem. I don't put Matthew's picture up here. Matthew was a sudden death. He was an intern in our office. He had a troponin I mutation, but his heart also sits in the collection, but is not, I don't take pictures of it. And I was very happy to be at the American Society of Echo meeting last weekend with somebody in the back row here, and was privileged enough to sit with him at the gala dinner. So I think he has another picture similar to this because he asked me to send him one. But it was great to be at ASC, and we were able to bring actual real patients out to be imaged and used as teaching tools, their hearts. And we brought the anatomic heart collection as well, and it's just another way of teaching the world about HCM. Special thanks to our friends here who are hosting us today. You guys did a great job this morning, and I'm sure everybody learned a lot. This is the team that it takes to build the HCMA and make us all able to help you every day. Everybody plays their own role. We have a lot going on right now at the HCMA, so if you're interested in volunteering, I encourage you to step up and do that. We thank all of our sponsors, all of our partners, all of our contractors. It has really been a labor of love to bring this all to you. It came from a place of pain and loss, but with the hope that every patient with HCM gets safe access to the highest quality care that they can. And if I've not met you yet, I look forward to doing so, and I thank you for your time and attention.